Welcome to the health seminar. My name is Fred Gishuki. Today is not my day. I'm just here to introduce our guest speaker. This is a gentleman I've known for quite some time. He's a medic by training, and he's going to tell us more about himself. But he's somebody who has a wealth of experience, both on the medical side and on the wellness side. So he's the right person to tackle today's topic, all about ulcers and digestive health. And without further ado, I want to welcome Riphath. Karibu sana Bwana Riphath.
Thank you, Bwana Fred. My name is Riphath Simba. I'm married, and I'm blessed with the two young ones. They are heading to teenagers because they are now in first primary. And I am a biomedical scientist by training. And I was attracted to join NeoLife by the challenges I saw patients undergoing and not giving them a solution which they came to seek at the hospitals. So today I am going to talk about ulcers, and majorly I'm going to talk about any closed ulcers. We have open ulcers and any closed ulcers. Open ulcers are commonly known as wounds, but enclosed ulcers is the one which is common, known as ulcers. And maybe I can be able to talk about the areas where mostly it's found or is located. Maybe I can start by defining what ulcer is. I can say it's a sore that develops on the lining of either the esophagus or the stomach or the small intestine. We have a part of the small intestine called duodenum, and that's where mostly the ulcers are found or they develop commonly past the stomach. The ones in the stomach or in the duodenum are mostly known as peptic ulcers. And they may develop because of either somebody is having a bacteria we call Helicobacter pylori, which is commonly known as H. pylori, or this person is suffering from another condition. He or she regularly uses some drugs which we call NSAID, non-steroidal anti-inflammatory drugs. Maybe an example of these drugs is ibuprofen, commonly known as Proven. And most people use it to manage their pain, or we call them pain relievers. They can be used together with other drugs or with other medicines which somebody is being administered to, depending on the condition the person is suffering from. So let me just explain about H. pylori. This bacteria mostly lives or thrives in the mucosal layer that covers and protects the tissue that lines the stomach and the small intestine. So if it gets there, then it causes a swelling and an irritation happens, a swelling and an irritation. So when this irritation happens or a swelling is there, the body responds to that by producing a reaction to it. And this reaction now is called inflammation. And when this one happens, then it can cause an ulcer. Then we can now ask a question. What makes somebody to have H. pylori? H. pylori is a bacteria. We can get it from food. We can get it from a person who is infected by coming in close contact. Even kissing can transfer H. pylori. But H. pylori also thrives or lives or accelerates or multiplies faster when the pH of the stomach is commonly acidic. So it's the acidic environment which promotes the growth of H. pylori. And now when the H. pylori has grown as the commonest cause of ulcers, then it causes a swelling or an irritation, and irritation now inflammation, and you see now that's now what we call ulcer. Or somebody is using some drugs, even aspirin. Aspirin can use it for a long time, can trigger ulcer, and then the ibuprofens and the other related are the same family of non-steroidal anti-inflammatory drugs. Over time, they can irritate, they bring the irritation or an inflammation to the lining. And once an inflammation to the lining happens, then either it can be in the stomach or in the intestine, then now that area then now develops an ulcer. So the sore grows. Then we can move ahead. We say, what are maybe the symptoms of somebody who is having an ulcerated or an inflamed stomach mucosa? These are the symptoms. There is pain, there is belching, there is appetite changes. Some people develop nausea. Some even develop weight loss. Some have the challenges of bloating. If it's not well managed, it develops or it grows into bleeding. So somebody can vomit blood, which may appear as a red or a dark spot in the vomit. Some can even now have dark blood in the stools when they go for defecation. So those are some symptoms one can use to monitor or gauge that there's something which is happening. Some even a heartburn, a consistent heartburn is a sign of unmanaged pH. So meaning the pH is acidic continuously, and then it can be an indication that if not well managed, it can trigger the growth of H. pylori, which can accelerate or which can bring the ulcers. Now, who are at risk to suffer this condition? Number one, those people with the advanced age. I'm not talking about, I don't mean that if you are below 60, you cannot suffer, but those who are the risk factors, those who are at risk 60 years and above. Number two, anybody who has a previous case of peptic ulcer, the occurrence is easier. It's easier for the ulcers to reoccur. Then those who use the non-steroidal anti-inflammatory drugs openly. And who are these? People who are managing pain. People who are using blood thinners. And now, from my experience, if I was talking about high blood pressure, how it's managed, mostly we manage it using blood thinners or vasodilators. So if this person is the high blood pressure is being managed by blood thinners, then this person is at risk. If this person is suffering from depression, so they use certain antidepressants. So some antidepressants, they fall under this category, which can bring irritation to the mucosa of the stomach lining, or the lining of the stomach. That's what we call it, the mucosa. Then we have these people who are suffering from osteoporosis. Now, there are drugs they are using or they are prescribed, which also affect or irritate the stomach mucosa. So people with bone challenges, mostly those who are managing osteoporosis or arthritis. So, and that's why I talked about the risk factors. You can be below 60 and still you are having osteoporosis, you are having pressure. So you are using some drugs which are falling under the category of non-steroidal anti-inflammatory drugs. Then, apart from those who are at risk, then we have factors which accelerate, meaning that if somebody has already developed ulcers, if you engage in the 4 factors which I'm going to talk about, then your ulcer will be accelerated, or it will grow faster, or it will affect you much faster than somebody who's not engaging in the 4 factors which I'm talking about. Smoking is one factor, it accelerates ulcers. Drinking alcohol, alcohol irritates and erodes the mucosal lining of the stomach and increases stomach acid. So if somebody, you take alcohol and already you are suffering from ulcers, now you have not only increased the acidity in the stomach, but also you have eroded through the substances you have taken, you have eroded the mucosal lining of the stomach. It's like now you have dug the ulcers deeper. So drinking alcohol, that's accelerating factor number 2. Accelerating factor number 3 is having untreated stress. Now, sometimes people with a chronic stress or people who have suffered from stressful conditions for a long time, they develop ulcers. Why? When you subject body tissues to stressful conditions, most of the time they produce acid. And this acid moves from now the tissues and settles in the stomach. So, and as I have said, it's going to do 2 things. It's going to promote this person to develop or for the H. pylori to grow, because H. pylori thrives in acidic condition. And now you can see now the process, how it begins. So H. pylori is there. Somebody is now having stress, maybe is lacking school fees, or maybe they are having unmanageable family issues. And now because of that, the acidity increases. And now this person is going to accelerate the ulcers. Stress may not be the major cause of ulcer, but it accelerates by several processes which I have just named. Another one is eating spicy foods. Eating spicy foods. People with ulcers, when they eat these foods, these spices, most of them, they are acidic. Not only spicy foods, maybe I can talk about even there are some people who, when they eat beans or sukuma wiki, their heartburn increases or they feel discomfort. That's an indication that your pH is acidic and you need to do something about it. And if your pH is acidic, then it's promoting the growth of H. pylori. And that H. pylori is bringing irritation. And the rest is, you can see how the process now moves on. Now, what happens when you don't take care of these ulcers properly? Sometimes people just walk into the chemist and they prescribe over the counter. But before, maybe I can go to what happens in uncontrolled or improperly managed ulcers. How can somebody know that he's suffering from ulcers? One of the major ways they go for tests of H. pylori. That's the commonest. H. pylori. You go just walk to the lab and they check whether you are having H. pylori. So if you are having H. pylori, then you are at risk. Now you start managing the H. pylori, because H. pylori, if it thrives, it brings inflammation. Number two, another way which the conventional way uses to diagnose is called endoscopy. Endoscopy is a procedure whereby they insert a certain camera to the stomach to take a picture of the stomach, how it looks like. So, or the digestive system, and then it records that one. Then the clinician or the physician is able to note if there is ulcers in the stomach or in the esophagus or wherever you are having the challenge. Now, what happened to untreated peptic ulcers? Number one, they can cause bleeding in the stomach and in the duodenum. And this bleeding, if it's not controlled, it can lead to anemia. Now, because this chronic ulcers, if they are there for a long time and they reach a stage where they can, now they are bleeding, because now if you develop, it's like now you have opened the stomach mucosa. The stomach mucosa is also served by capillaries, blood capillaries. And now these capillaries, they are punctured. They will now release the blood into the stomach. And now we will be having internal bleeding. Somebody may not be knowing that is or she is internally bleeding until maybe the condition could have gone to another stage, which is not the good one. Another one is perforation. Perforation or a hole in the stomach wall or on the intestine, leading to infection. This hole, it can be, the ulcer can be so deep, we call it perforation. And this can lead to infection. Another one is untreated ulcers can bring blockage. They can prevent food from going through the digestive tract. And it makes somebody feel full. When somebody is having this, now I'm reaching this stage, this person is not going to eat out of food, because if there's a blockage and the food is not going, it means now they can, one of the symptoms, they feel that they eat a little food and they say, I'm full. So it's a challenge and it needs to be taken care of. The last one is that studies have shown that people with H. pylori have increased risk of developing stomach cancer. So why should you manage these ulcers properly because of the 4 things I have highlighted. But also, these are just about ulcers. Now, if this pH is not well managed, there are other conditions which it can trigger, more so when it's related to bones and joints. I usually advise my clients that if you have an acidic pH, we are now worried about 2 conditions, about one developing ulcers, another one developing arthritis. Why arthritis? When there's acidic pH, the body itself will try to, in a normal way, how it's trained, to try to balance the pH, to bring it to neutral. And one of the ways it does is by mobilizing calcium from tissues or from the stools or from wherever it is to dilute this acid. For one to have acidic pH, it means now the body is unable to dilute this acid. It has withdrawn calcium from the adjacent tissues, and now it has reached alarming rates which it cannot withdraw. So, advise your clients, those who are experiencing acidic pH, to not only manage it effectively, to avoid developing these 4 conditions I've just highlighted, but also there are underlying conditions like arthritis, which also is not a nice condition. So, how do you manage ulcers using Neolife products? Before I talk about the Neolife products, I have emphasized mostly on the side effects of drugs known as non-steroidal anti-inflammatory drugs. People can develop pain of whatever nature, and they just walk to the chemist and they ask for pain relievers, not knowing that they may be solving one condition. They may be trying to manage the pain while promoting the body to develop another condition. So that's why we have Neolife products. And Neolife products are naturally nutritious. And they are geared towards managing cellular health. So I've talked about stress and acidity so much. We have aloe vera plus. So I've gone to the solution. We have aloe vera plus. What does aloe vera plus do? Aloe vera plus is an antacid. Aloe vera plus is anti-stress. So what it does basically, aloe vera plus does not heal the ulcers, but it dilutes the acid. And if this person, the major source of this acid was because of stress, it manages stress to a certain level, whereby now this body is not going to produce the acid. So basically, aloe vera plus is for bringing the pH to neutral. Having done that, combine aloe vera plus with gelated zinc. Here now we are talking about ulcers. Somebody else already has developed closed wounds. Zinc is very good in now bringing healing, the tissues again to come together, to hold together. So while aloe vera plus now balances the acid, it gives room for zinc to bring that healing. And as you are aware, for those who are distributors, somebody with chronic ulcers may not use only one bottle of aloe vera plus, nor one bottle of gelated zinc. They will have some wound relief, but that's not a surety that the ulcers have completely healed. Now, Apart from the two, give this person high doses of garlic, allium complex. Why garlic? Garlic, we have talked about H. pylori so much. Garlic given in high doses of around 4 tablets per day, it clears and eliminates H. pylori nicely. Let the person use at least 2 buckets in a month, and they will be enough. Now, there's inflammation in the tissues. Instead of the anti-inflammatory from the chemists, which we have found that they are having a side effect, we have a natural anti-inflammatory by the name omega-3 salmon oil plus. Very nice products. Very nice products. And not only for inflammation, omega-3 is important for those who are trying to manage the pain, be it in the headaches, be it in the wherever, any pain in the body, omega-3 manages that pain efficiently well. But you cannot give the 4 minus 3NN. 3NN is going to prepare the cells to receive these nutrients. So give 3NN. Give 3NN. 3NN is important. By the way, all the 5 products are important. But also, sometimes now we get to weigh which one do I give and leave when it comes to now the cost. But advise the clients that using the 5 of them at once will bring a better prognosis than using in segments. So that's the best way you can do it. And I want to acknowledge that ULCERS, when I was a new distributor, this is the program which built confidence in me in sharing the products. Because I remember a neighbor of my sister asked me if I can manage ULCERS. And I gave her the program as I have indicated here. It doesn't change. And I tell you that already the ULCERS cleared up to date. She doesn't have the ULCERS. And all the time she used to tell people, I have somebody who knows how to deal with these such conditions. So go out. So who is supposed to use these products? Who is supposed to use these products? Anybody who sometimes experiences heartburns, let him use the products. Why am I saying like that? Sometimes the process of trying to diagnose ULCERS may be so costly than the program itself. So just use people who are working in an environment which gives them stress. People, after working, they develop headache, migraines, they go for painkillers. They need to use this aloe vera plus. They used to use gelated zinc. They need to use garlic. They need to use some salmon oil. They need to use 3NN. Because they will take care of the condition. They will prevent their bodies from going down to stress. They will prevent their bodies or their tissues from developing that high acidic levels. And then they will prevent now from the inflammation, which is caused by the high acid levels in the stomach. Back to you, Mr. Fred.
Thank you. Thank you so much, Riphath, for that. Short and sweet and to the point. Guys, there you have it, the program for ULCERS. I must say that I also had a breakthrough with that program with my dad. He had very serious ulcers. His were bleeding. At one point, he was operated on, nearly lost his life. And after that, he could not eat so many things. I put him on the program. Within about 4 months, his ulcers disappeared. Today, he can eat anything. He's over 80 years of age, and his favorite drink is fermented milk. So I can tell you the program works, and it has worked for many. And if you're here and you're having a challenge that direction, don't hesitate. Don't hesitate to share these products and recommend them with boldness, because they do work. I remember a case of a gentleman that I had dealt with for quite some time because of H. pylori, and I had not introduced garlic. The moment I introduced garlic, I tell you, the H. pylori disappeared. And somewhere along the way, his son had also developed. And it's good, Dr. You've talked about H. pylori being infectious, because I think the dad infected the son, because I wondered why the son developed H. pylori, yet we were dealing with the dad with H. pylori. And we also bought the program for the son, and we were able to sort out that problem. So this is a program that works. And just to cap it, as far as the products are concerned, maybe Riphath, you can just repeat the items that you've just talked about that one can actually use for ulcers. Riphath? Okay, I think he has moved away from his mic. But just to cap it, he has mentioned a couple of products. He has mentioned 3NN being number 1. He has mentioned Aloe Vera Plus being number 2. He has mentioned zinc being number 3. He has mentioned garlic, and he has said that you need to get 4 garlic per day, 2 times 2. Yeah, and in a month you take 2 packets of garlic. Those are 120 tablets, and that can be able to sort you out very, very well. These are the 4 items. There's another one that he mentioned, omega-3 salmon. Omega-3 salmon for lowering inflammation in your body, which actually has been caused by the ulcers. Okay. Now, I can see we have some questions on the call. Riphath, I don't know whether you are there. You could answer some of these questions.
I am there. I am.
Okay. Somebody is asking about fiber, whether fiber is good for somebody who has ulcers. What do you say to that?
It can be another product, but as per se, it's just for elimination. But we cannot go that way if somebody doesn't develop protein. For somebody who has a case of protein, that would be good for the person, or even stage 6.
Okay. I see somebody asking, I'm using drugs for H. pylori now, but I'm still using Aloe Vera Plus. Is it good for me? Advise me, please.
Yeah. As much as we are using the drugs for H. pylori, that's good. Let the person continue with the products, the program. You see now why is taking H. pylori. As much as he takes H. pylori, I know the kit. I know how the kit works. The kit's not having the program which takes care of the healing of the ulcers. Now the kit takes care of the H. pylori itself. But what about now the healing part of it? Because if it's not healed, then if H. pylori is not completely eliminated, again it will grow. That's why we are talking about when we manage the acids that is BH through Aloe Vera Plus, then we take garlic. Now garlic is the kit is taking place of the garlic. Then zinc has to be there to bring healing. Hiyo shimo ifungike vizuri. That's what we're talking about.
Fantastic. I can see somebody saying my children are suffering from ulcers. I believe the program can also work for children.
Very well. Except now,
fantastic.
if the children are below 10, instead of 3 let them give with the squares.
Okay, fantastic. Let me ask you a question. What role does vitamin B complex play on this program?
You know, you are the one who has introduced the PEEP complex. Now, it's about two things which it does, but unless somebody now has been having the chronic one, it's about increase in blood. So if somebody is having the chronic and he has been vomiting blood, or we suspect he has been having internal bleeding, and also now, when it comes to eating, restoring the sensitivity of the stomach, the nervous system of the stomach, basically.
Okay, that's okay. Thank you so much. Yes, I believe we have answered all the questions on the call. And mine for me, yes, sir.
I saw somebody
Yes.
comment saying that he developed ulcers by chewing opiates.
Yes.
Let me talk about it. Let me talk about it briefly. Now, maybe I did not talk about the risk factor. It's about among the risk factor, whereby if you are angry, you chew, or you chew a gum or a sweet. What basically you do to the body, immediately the salivary glands test that sugar levels in the chewing gum or in the sweets. It sends signals to the stomach to prepare to receive a lot of food for digestion. So we end up now the body producing hydrochloric acid for digestion. We call them gastric juices for digestion. And now you don't give the stomach food. So you promote the acidic pH in the stomach for a long time. Now that now triggers H. pylori and the process continues. So avoid chewing or using sweets on empty stomach. Back to you, Fred.
Wow, I think that's a very, very profound thing that you've just shared right there, because many people have a tendency of getting chewing gum and you chew as you go. Maybe you're not even having lunch. You just put a chewing gum in your mouth and you chew maybe you're traveling for a long distance. You're chewing and you will not eat food in the near future. And you end up you feel so drained and you feel so weak and you're wondering, what is the problem? I think what you've just shared makes a lot of sense. And it's important for us to really identify that can be a serious causative factor. There's somebody who's asking the types of, if you can mention the various types of ulcers.
I talked about peptic ulcers, which are the two. We have they develop in the stomach and the duodenum. So we can call them stomach ulcers. We can call them duodenal ulcers. If they now where the ulcer is in the duodenum, we call it the duodenal ulcers or ulcer, because now it has developed where the duodenum is. If it's in the stomach, we call it stomach ulcer. If it's in the esophagus, because the esophagus also can develop an ulcer. So that's where the ulcer is. There are other we name them according to where they are located. The organ, where they are located.
Okay.
Now, if we talk about the open wound, now we can say the ulcer on the leg. If it's open, the leg, something like that. That's how it's called.
Okay. I think one key point that I've gotten from your presentation is that we should strive at all times to prevent a situation where our body becomes acidic.
Yes.
By trying to avoid the causative factors that you mentioned about alcohol, being in a stressful environment. We can't avoid stress all the time. And that's why you advised us that we need, pardon?
Untreated ulcers, untreated stress, treat the stress. That means you can have stress, but now, if it's taken care of, then it does not lead the body to producing acidity.
So deal with the issue that is causing you the stress so that you can be able to come out of it. Because I think that is a key thing. If your body is acidic, then definitely you will actually end up, you're predisposing yourself to getting ulcers and many other conditions. So lifestyle does play a huge, huge role as far as ulcers management and prevention. Yeah. Okay.
Yeah,
let me just.
If one has a client who drinks and is having ulcers, it's going to really have a thorough order in managing that one unless the person is going to lower the alcohol levels he's taking.
Okay. I think we can take one last question here. There's somebody who's saying that I developed some pain on my left side of the body, specifically on the back, after taking some medication on H. pylori. What could be the cause of this?
What happens is this. There are some the drugs which are managing ulcers. They are also calcium inhibitors. Most of them, they are calcium inhibitors. So that's a sign of developing, if the person did not go for a screen, it can be, the pain can be, maybe already the ulcer was there. Somebody can be now having take H. pylori, but already the ulcer is there. So it can be a sign of the ulcer which is there. H. pylori does not, when you take drugs for H. pylori, does not heal ulcers. You kill the bacteria, but ulcer remains. So there are chances that the person is having ulcers and is still there, or the person, the calcium levels went down because of the drugs which are managing ulcers. So it needs further investigation.
Okay, just a clarification there, and I just want to make this distinction for the sake of the audience that we have here. You said that when somebody gets a H. pylori kit, it will kill the bacteria, but it will not heal the ulcer.
Yes.
Okay, I think that's something that many people.
H. pylori is targeting the bacteria. But you see now, if already the bacteria is in the body and the person has promoted the person to have ulcers, and you take now the kit is going to kill the bacteria, but the ulcer is still there. It has not been taken care of.
Okay. Yeah, and I think that there's a lot of misconception in the in the clients and many people who take that kit, because they take the kit, they finish the kit, the pain is still there, and they're wondering, I'm not healed, what is happening? And again, they want to go for another kit. And I think that distinction is very important, because it means that somebody needs to take something now to heal the ulcer itself after you've dealt with the bacteria.
Yes, that's now this program, which I've just highlighted, it deals with both the H. pylori and the ulcers at one go.
Fantastic. So guys, I believe we've tackled that topic very exhaustively. Thank you so much, Daktari, for that. You've really done a wonderful, wonderful job. You've demystified a lot of things that for us lay people, we may not have known about ulcers and ulcer treatment. And I believe we are empowered. I believe we have gotten some knowledge that we can use to prevent ourselves, first of all, from getting ulcers, and to prevent our families from getting ulcers, and also to help anybody out there who might be suffering from ulcers or H. pylori at this particular time. So we have come to the end of our session. Guys, it was great having you on board. Next week, we'll be back again. We'll be talking about a different aspect of health. I want to once again thank Dr. Riphath for that very powerful session. And for those who want to know more about the business side of it, I must mention there's a business behind these products. If you're looking to make some extra income, you've come to the right place. We have a system in place that can help you to make a lot of money with these products, and we are going to show you how to do it. We are beneficiaries of the system. I know Dr. is already an Emerald Director in the business, making very good money from Neolife. I also do the business on a full-time basis, making very good money. So these are systems that you can also be able to use to make some extra income. And later on, you can make it your full-time business if you want to do that. But to get to know more about how to do the business, tomorrow at 8 o'clock, we will be back on this same link that you are sent with Pascal Olo, who is a great leader, an engineer from South Africa, who will be taking us through how do you make money? How do you make money with these products? And how can you be able to really become wealthy in the real sense of the word in your life? So tomorrow at 8 o'clock, we'll be back again on this link. Zoom in, come with a friend, and you'll be able to learn how to make money and how to grow in the business. Otherwise, for this health session, we'll be back again next Sunday, and we'll be having a different speaker. We'll be taking us through a different aspect of health. Thank you so much. God bless you. Have a restful Sunday evening. This recording will be available a little bit later so that you can be able to share it with a friend, a neighbor, a relative, and let's join on this venture to make the world a healthier and a happier place. Adios and goodbye.